This is not the first time mis and disinformation has hit us, and it shouldn't take a pandemic for it to be so obvious. I believe every day in medicine is a crisis. And so it really inspired me to write my book, which is a post-pandemic review of the history of mis and disinformation in healthcare. Not surprising, I'm sure, to someone like you, but mis and disinformation has been around a long time. What's different now is the technology. What's different now is social media, artificial intelligence. And as a result, mis and disinformation are traveling 6 times faster than the facts. And so if we don't address it, that's really the headline, that this is going to get worse, not better, unless we really acknowledge its presence and stop ignoring it.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Geeta Nayyar, MD, and we are going to be talking about her new book, Dead Wrong: Diagnosing and Treating Healthcare Misinformation Illness. Dr. Nayyar, also known as Dr. G, has been at the forefront of the intersection of healthcare and technology. She's been a guest on CBS, CNN, CNBC, among other outlets. And we're going to be talking about some of the pluses and minuses of how technology and healthcare intersected, how we can sift through disinformation and misinformation in the healthcare field, and in this age of social media, and determine what is real and what isn't real. She talks about the HIV/AIDS epidemic to the COVID-19 epidemic and recognizing misinformation and how we can do better with that. We also get into how healthcare is transformed because of technology, some of the advantages to diagnosis and treatments, and the advantages of virtual appointments. I really enjoyed this talk. It's something that I've been thinking about for quite a while as the technology has become more and more a part of our lives. And Dr. Nayyar is incredibly insightful about all this, and I learned quite a bit on this episode, so I hope you do too. So here she is. This is Dr. G, Geeta Nayyar, MD. Dr. Geeta Nayyar, I am so glad you're here. I've been looking forward to this, as I said before we started. We're going to talk about a lot of different things with health, but one of the things I wanted to start with was, I know you've been on a number of television shows and news programs talking about some of the things that are going on with the media and the social platforms, about things that aren't exactly true, and I'm being kind. But there's some false information. There's some things being touted that are probably not so great. And I want to talk about some of those things. I have a few that I want to ask you about myself, but tell me how you got started doing this part of it, of your medical career, because it's a really great service. Because I don't know. I mean, there's stuff, I get sent things. I get things that pop up on my feeds. I don't know, but and then it's learn more, which I always know means buy this down after you watch the video that takes 55 times longer than it should to get to lull you. You know what it is? You click on it to learn more, and then you're lulled into this strange world of this person that tells this story that's so long when they could have just done it in the first part. So that's what makes me suspicious right away. That's me. So let's go. I'm talking way too much. I got a great guest, and here I am into myself, which I'm not really even that into myself. I'm just talking too much. Go ahead.
Well, Bob, first of all, thanks so much for having me on, and thanks so much for covering the topic. Just, a little bit on my background. So I'm a rheumatologist by training and have really spent a large part of my career kind of at this intersection of business, medicine, and technology, which is increasingly playing a role in medicine and every industry for that matter. Really what inspired me to write my book, Dead Wrong, was sitting in my home office during the pandemic and watching what I felt like was deja vu from the HIV/AIDS epidemic.
Hmm.
It was a very similar feeling. It was a very similar crisis sort of feeling for many physicians. I was a young physician at the time of HIV/AIDS, and we were told, you're going to be a better doctor for this. You'll understand public health. You'll understand all of these things. And then I found myself as an attending at University of Miami saying the same thing to my medical students during COVID. And I said, someone needs to tell this story because this is not the first time mis and disinformation has hit us, and it shouldn't take a pandemic for it to be so obvious. I believe every day in medicine is a crisis. And so it really inspired me to write my book, which is a post-pandemic review of the history of mis and disinformation in healthcare. Not surprising, I'm sure, to someone like you, but mis and disinformation has been around a long time. What's different now is the technology. What's different now is social media, artificial intelligence. And as a result, mis and disinformation are traveling 6 times faster than the facts. And so if we don't address it, that's really the headline, that this is going to get worse, not better, unless we really acknowledge its presence and stop ignoring it.
Well, there were so many COVID things. We can talk about that first because there was so much information flying around about that, as far as even the vaccines and how it started. And I'm still not clear on any of it. It all seemed really sort of murky and strange to me. Um, I don't really even know. And I know some people that are into conspiracy theories, which was some of that stuff was so far fetched that so let's talk about the COVID part first. What seems to be real and what seems to be completely out of left field?
Well, I think what's really clear to me after COVID is everyone has gotten the reminder that health is wealth, right? There's no one really walking around not thinking about their health or not looking to buy, even with their own money, not even through insurance, a watch, a ring, something to measure steps, mood, sleep. It's really become very mainstream now.
Mm-hmm.
And as a result, we often don't know what we're getting though, right? Like when a patient comes in and is like, here's every heart rate I've ever had since the last time I saw you. And it's like, TMI, that's actually not important information for me. What's important is trends, when you're symptomatic, et cetera. So we're still learning how to actually use some of these things, even though we can measure it. The actual interpretation and meaning is still in many different scenarios being sort of understood. But I think that's the number one thing, is that the everyday consumer is falling victim to many of these things because they're so interested in being healthy that you can almost sell them anything and they'll go for it thinking this is actually the holy grail, right? And so I think that's the biggest opportunity in healthcare, is that we, as physicians, healthcare leaders, one of the call to actions in the book is to say we have to take the story back, right? Science needs to take the story back. And what struck me the most during COVID actually wasn't all the craziness that we saw, but I said, how is it that people don't know the difference between a virus and a bacteria? Because if you knew basic science, if you had basic, what I will say, science literacy, no one could ever sell you something different, right? Just like if you knew the Civil War, American War, like just like certain facts, nobody could ever convince you otherwise. And so I think for me, the biggest shocker was, how is it that people don't know that difference? And how is it that they don't understand washing your hands is always going to be a good idea for so many reasons as it relates to prevention? And so I think those are the things that really struck me as, wow, we've just done a really bad job of simplifying science and making it much more palatable and reachable to the everyday person.
Yeah, and I think some of that's the responsibility of, I'll just say us, people.
Absolutely.
In the educational system, people have gotten lazy, and the schools have kind of slacked off on a lot of the science that I had. It was pretty thorough. I know what rods and cones are in my eye. I do know what that is.
That's impressive.
And a lot of people don't. I have an eye condition, so that's why I know.
That's great. And that's a great example of taking control of your health, especially when you have an issue, is you should be the smartest person on that issue and have an actually better, more meaningful conversation with your doctor as a result, and probably stay on your treatment. That's what data shows us. When patients are actually active, shared decision makers and learners in their care, shocker, they take their medication. Shocker, they will make the lifestyle adjustment. Right. And shocker, they trust their doctor and is like, hey, we get each other. So like, you're my one, like nobody can convince me otherwise. You're my person.
Yeah.
And I think all of those things are missing nowadays, you know?
Well, to me, the best doctors are help you do you, with information
Absolutely.
and guidance, but they're not you. They aren't you, and they don't know. Let's say we'll just say, the food you're eating is not agreeing with you, and they're saying, well, you need to eat that, and it's like, well, I can't because it doesn't. I don't feel good when I eat it. So my body is my, is a test tube in a sense. I'm just picking nutrition for just because it's a simple thing and everyone has to eat. And so I know by experience what works for me and what doesn't.
Absolutely. There's nobody that can know your body better than yourself. And the number one rule in medicine is always to listen to the patient and treat the patient, not the lab. But I totally agree with you that we have to be better partners to each other. And I think in today's world, part of that discussion has to be, what should I read, doc? I have this eye condition, what do you recommend is like the 101 on this, that, or the other? And I have this conversation frequently as a rheumatologist who deals with really complicated diseases that are often esoteric and where we're still learning a lot. And so I often tell my patients, if you go on Google, you're just going to get really scared. Like, this stuff is so complicated that this general search is about the worst thing you can do, because it's going to tell you you're going to get tuberculosis. It's going to tell you you're going to get lymphoma, right? And so instead I say, look, I recommend the Arthritis Foundation. I recommend the Lupus Foundation. They are patient groups that deal with patients in this area every day. And the people in those communities are going to be fast friends. And it becomes a very different conversation, because then patients are able to go to the right sources and then come back, which is what I want them to do, with their questions, right? And then I'm able to answer them before they've been convinced of something without me even having a chance to explain, the pros and the cons of potentially a therapy. And truly, I think some of the best physicians are actually great teachers, because that adage, I'm going to screw it up, but the adage of you can feed a man a fish, you can give a man a fish and feed him for a day, or you can teach a man to fish and feed him for a lifetime.
Mm-hmm.
I believe the same thing about medicine. The more you help people understand science and the human body, the more independent they become about their health and their health choices. And that's ultimately what we want as docs, is we want to be the coach that's there to help guide you and give you options and opportunities and what we think is best in our experience or in our research. But ultimately, it's your game, right? Ultimately, it's you that has to live this. Oh gosh, now we're getting philosophical. This game of life, right? Ultimately, we all have to live our own game.
Yeah.
So,
well, there is that component to how do I want to live? What's important to me? And I like that aspect that most doctors don't even talk about it. But what is the it's, yes, doctors deal with the body, but there's also the mental piece of it, the mind and the spirit of the person. And so those things, if you bring them into an integrative way of looking at things, that can be very helpful. I mean, doctors are just starting to even ask people about their stress levels, for example. Is there a mitigating situation? Are you depressed for some reason? Maybe something really crappy just happened. Maybe you have actually misinformation and you're walking around terrified. People hear the word cancer and they immediately think dead. It's absolutely not the case.
that's right. And I think and to your point, I think one of maybe very few of the silver linings from COVID, one of them being virtual medicine becoming a reality, but mental health. Mental health has become a priority and something that I think we've made progress in, with regards to taboos and just having the conversation. And certainly the body includes all of the things you mentioned, and it's a miss when you're not acknowledging all of the above.
Yeah, I don't know how much time is spent in medical school talking about these things. I think very little. At least, my daughter's actually in medical school, and I ask her these questions.
Oh, wonderful.
So,
Wonderful.
yeah, it's pretty great. She's about to take her step 1 exam coming up. So yeah. But I ask her, are they teaching any ethics? No, I haven't had that yet. I go, I don't think they do anymore.
Well, no, I mean, we certainly took bioethics. I remember it distinctly. One of the most interesting classes. Actually, There's all primarily on end of life issues. There are many ways that ethics is important, but look, I think that we continue to have room for improvement. But I think there's no doubt that medical education needs to change with the times, right? And I think we are seeing progress. We are seeing MD MBA programs. We are seeing integrative medicine tracks. We are seeing artificial intelligence and how this is going to play into the future of medicine. So no doubt there's room for improvement, but I do think that there is progress being
Yeah.
made.
That's the one thing I absolutely think is great about AI is the medical piece of it. I think the potential for incredible amounts of accurate diagnoses and possibilities, and the acceleration of information in cures and gathering information from around the world is so up to date and moving so quickly that that part of it is going to be amazing. And let me add this, the genetic testing that has been improved on to the point where you can get a readout of your genetics and find out, what genes, what version of genes you have and what predispositions you may have toward health or the opposite. And then you can go from there. I mean, that sort of precision medicine piece of it is really interesting to me.
Oh, it's incredibly exciting. It's incredibly thrilling for a technologist and a physician like myself. I think the opportunities are limitless. And in the diagnostic and therapeutic space, I think it's just the beginning. I do think we have to be mindful of the human factor. I do think we have to be mindful of maintaining the trust between the doctor and patient. And we have to be mindful that ultimately when people come to the doc, they are looking to find someone else's eyeballs on the other end of that conversation. So I don't think robots are taking over clinical care at any time, but I certainly believe they can be in the background helping us make good decisions, helping us diagnose disease quicker, better, faster, and again in the therapeutic space. So I'm with you. I do think we have to be mindful, to your point of the ethics, we have to be mindful of health equity and disparities, and that we are equally applying technology in a way to understand populations. Unfortunately, we don't have a lot of data. AI can only be as good as the data we give it, right? And so unfortunately, particularly in underserved populations, we don't have good data. And this is something we have to be mindful of and make an effort, an added effort as we learn more about what it can do and what it can't do.
Here's the difficult part, I think, with any sort of treatment or diagnosis is what is the patient willing to do for themselves, not just looking for a magic bullet, but change lifestyle. That to me seems to be one of the hardest things for people to understand, is that you have a responsibility yourself. I mean, yes, somebody can give you a pill for, you can take insulin for diabetes, but if you're pounding down pies and cakes and ice cream, well, what's going to happen? What do you think is going to happen? So that's the piece that, I don't know how medicine can deal with that other than to gain some kind of a trust and explain to a person and have them be desperate enough to go, ooh, maybe I do need to, cut back on things that are not healthy for me and start to walk even, just beginning. Do you run into that a lot with people?
Yeah, absolutely. Human behavior is one of the hardest things to change, and it depends on so many things outside of medicine, like your environment, your spouse, your culture, your religion, where you are in the world, what stage of life you're in. Have you had a life-altering event? I mean, often one of the biggest ways to change a behavior is we see it when someone has had a near-death experience, right? They've had a heart attack, they've had a stroke. It's an incredible incentive for folks who live through things like that to say never, never again. That said, I've also seen spouses, for good or bad, have big influences. The men in particular, the wife who says, "Hey, we're going vegan, like it or not, this is what's happening," and it happens, right? Or the spouse that says, "We got to have meat 3 times a day, and beer is part of the diet, and so smoking." It doesn't matter what an individual does when they're in an environment like that; it becomes incredibly harder to change. So I think it is. I think health is a team sport. It always has been a team sport and likely always will. But this is why I would tell my 12-year-old, choose your friends and your family that you can choose wisely, right? You got to choose wisely. And if you are trying to make a change, changing your environment is part of that. right? Changing your
And
environment is part of
sometimes
that.
that's a big change. I mean, sometimes it's literally having to extricate yourself from a relationship that's, not going your way. And now when I was dating, which was a very long time ago, I wouldn't date women that smoked. I just wouldn't do it. I didn't want to fall in love with somebody that was addicted to tobacco. And I also saw it as kind of the top of the pyramid, like what's underneath that, because there's got to be a bunch of other stuff going on. And somebody's an addict of some type like that. So,
Well, we all have value systems, and I think you're just wise to, right? We're all wise to choose according to a value system that's easy for us to be in. That said, love is love. That's hard. So,
yeah.
you did it, but it is
Well, I
hard.
mean,
It
I
is.
dated women that weren't good for me for many reasons, but smoking wasn't one of them.
Well, it sounds like your daughter will help keep you on track. So I'm glad to hear she's in medical school, and
Yeah,
that's
yeah, it's really, I love talking to her about it. I mean, she's in the world, so you know what that is. It's very competitive and kind of, they.
You should have her on your podcast if you haven't already. You should have her on.
Once she passes that test, I'm going to have her on.
You should. Oh, I think that would be so
Yeah,
cool.
I mean, there's some really interesting YouTubes for if anybody's interested in medical school or is in medical school. There are medical students that are posting a lot of really interesting things about from how to get in to how to navigate and ways to pay for it. I mean, there's all kinds of different people that have really taken some time to help other medical students, and I've watched a few of them. And there's no easy answers for a lot of this stuff, but it's a really daunting kind of a thing, but it's doable. I mean, there's some amazing doctors, and then you meet some and you go, how did you get to be a doctor? Because I don't get it.
I think that's probably in every profession,
Yeah.
right?
I mean, I'm fortunate in that I have found people that I like, but here's the other part that's sort of difficult with any of this kind of thing. There's so much information, so many specific kind of specialties that people can't know everything. They can only know a lot about maybe one or two, maybe three things that they've learned about. And so, you can take your doctor's information up to a point, but there's also, I mean, I have a great primary care doctor, but he doesn't know a ton about nutrition or exercise. He knows more than most. But, I have to do some extra kind of work on that piece of my health. I really have to look at certain things, I mean, he knows what the Mediterranean diet is, because it's sort of there. But it's got its limitations, and it does that work for me, I mean, just as an example. But but then there's that other piece on the B side of that. It's, well, I don't know about that. So you got to go to this special person. And then now you got to meet a new person and try to figure out, and then they have their limitations. Well, let me send you to the third person. I'm just giving like the worst case scenario.
Well, I think it's very similar to, any services business. I mean, whether you're talking about an accountant, a lawyer, I mean, it's really no different. Teachers, right?
Mm-hmm.
Very, very similar in that, you could have a family lawyer,
Yeah.
corporate lawyer, right? And same for taxes. There's corporate taxes, there's federal. So I think understanding that is terrific. And that's why we do have so many specialties in medicine. My space is rheumatology. You ask me something about GI or cardiology, I'll have general knowledge as an internist, right? General, but I won't pretend to know everything about, my gosh, now the microbiome and all of this stuff. I'm learning, I'm intrigued by it, but that's not my area, and I have no problem to say that. Similar to if a cardiologist gives their opinion about rheumatology, I kind of smile at that and say, this is just not your space, man. It's the wrong organ. And there's so much intricacy. I think that's the other piece is science is so complicated, and there is so much intricacy to the human body, and understanding that one entire organ can be a 30-year specialty, right? Your daughter's going to learn this very soon. And so, and as we learn, as time goes on, we learn more. I mean, look at breast cancer has essentially become a chronic disease. HIV has become a chronic disease. I mean, the amazing thing about medicine is we innovate so much in the research and science. And that's truly what's so exciting about AI, is that I think we'll be able to do it much faster now.
What comes up a lot on this show is that some of the chronic diseases that are very prevalent are actually diseases that never had to happen to people because they're lifestyle diseases. Let's put it that way. And that's kind of heartbreaking when you think about, someone suffering from something and they basically did it to themselves, with usually not, obviously not intentionally, but just a lack of knowledge or and the sort of the business aspect of selling people certain types of, I'm just going to go with food because that's something I'm very interested in, and foods that are not foods that are being sold, and pesticides and all these things that are very harmful to the human body are very much ingrained into the culture, and people get sick, and they don't have to get sick, but it is a lot more effort to go the other way, and it's a little bit more expensive on the B side, on the A side. I mean,
it is. And I was just going to say it is expensive. And that's where I think we have to hold regulators and policymakers accountable as well. Some of these issues don't exist in other countries, right? And so recognizing this doesn't have to be the way it is. And we do have an election coming up, right? And so remembering that healthcare is always on the ballot, and food is medicine. And so understanding all of those things, and in many ways where you live in the country has a big impact on health and health outcomes.
Yeah. Well, I've had people say to me, you're a health nut. And I'm like, I think I'm a health sane. I don't think I'm a health nut. You're eating poison. Who's crazy? I saw a list the other day. I don't remember any of it except for one thing, but it was 10. The list was 10 things that we have in this country that they don't even allow in other countries, or dial way back on permitting them things, and foods that are things that people are consuming. And the one I remembered, because I used to love the taste of them, was Ritz crackers. And it was like, Ritz crackers? And it's fake stuff, tons of salt, seed oil, everything. It's basically like a little poison wafer. Sorry, Ritz folks. Is it Nabisco? Who makes those? I don't know. But,
And there's so many examples: high fructose corn syrup, sodas, and we get kids literally on this stuff when they're like less than 10 years old. And so you're right. It's a huge part of what we need to work on as a culture, as a population.
Yeah. So okay, I'm going to give you an example of a couple. I'm going to ask you a couple of questions. There's a lot of ads, and I tried it. I'll tell you what the result was. Have you heard of this stuff called Shilajit? Shilajit?
I cannot say that I have.
It is some sort. You get it. It's like it's from a plant. It's plant medicine, and you mix it in water, and it's from like the Himalayas, which is already intriguing, right? It's a great sales tool.
How much is it? How much is it, Bob? That's my first question.
It's about $1 a day. It's not that much. I felt better taking it. I actually did. And they say take it for a month and then stop. So I'm stopped right now. I might go back to it. It's like a very thick kind of resiny paste almost. They make it out of a plant. And there's been a couple of, I guess, I don't know if the jury's still out on it, I guess, but exactly what it does and how it works. But I'm fascinated with that kind of stuff. And I've seen, I did watch a video, a podcast with Andrew Huberman talking about it, because he's very out there with the experimenting with all kinds of interesting things. I don't know what you think of the guy, but I enjoy his a lot of what he talks about. So I thought, oh, well, I did a little research. My friend was doing it. He said he had morning erections, which had gone away in he's 71. I said, oh, well, that's an enticement right there. We'll try that. That didn't happen for me. But thought I just mentioned that. You are a doctor. So, that's something I've tried, which I had seen on the internet, didn't do until somebody I knew had sort of, I sent the canary into the coal mine, basically. or he had gone involuntarily. But there's a lot of stuff like that, which I find really intriguing because I never would have even heard about it. And actually, it was recommended to him by a friend of his he grew up with who is an MD.
So, those kinds of things, and again, I don't know anything, about that, but that's the kind of conversation I would have with your doc. I mean, I would say, hey, I saw this thing, that I'm being treated for X,
Mm-hmm.
my kidney function is Y, right? I have patients who want to try things and we often we go through the things, right? And supplements are one of the biggest spaces here. And you have to be careful if you have kidney disease and liver disease and with interactions and how many you're taking and when you're taking them. So again, and there are things that we don't, we're still learning in medicine. And so this is the kind of conversation I'd have with my doc, and I'd examine what's in the plant, what's in it that possibly, turmeric, for example, has benefits, ginger has benefits, right? That would make sense, right? So these are the kinds of things. It's a great example of taking that to someone who actually knows you, but knows your health, knows your labs,
Yeah.
knows your cardiac function, your liver function, your renal function. I have seen any number of patients that have come in and what they thought was something benign, but it was the interaction of everything else they were doing combined with a limited kidney function or limited liver function, and had a terrible outcome as a result, right? All while thinking they were doing something healthy. And on the flip side, I've had, no issues, right? And someone who says, I'm going to try X, Y, and Z primarily for joint disease. And I say, look, it doesn't look like there's any harm, right? First principle in medicine, do no harm. I don't know of the benefit. You're saying you feel better. Well, if it's not harming you, feels like you're doing better, why not? Right. So those are just the kind of conversations and the balance that you want to do. And on the flip side, to say, hey, doc, do you know anyone doing research on this? Have you heard of this? Is your field discussing these things at medical conferences? Because you'll also get some insight and some inside baseball when you have some of these conversations to be intrigued by what other doctors are saying as well as they're in the research area.
Yeah. I mean, the part of the supplements is that, I try to, I do take certain things, but I don't know how you find out what the dosages are. And a lot of sort of doctors, MDs don't really talk about supplements at all. This is a kind of a darker view of things, but many MDs, I'm not going to say you, many MDs are basically shills for the pharmaceutical industry. And, when there's something that, especially if there's a condition that there isn't a pill for, then, it's not even talked about that much, not recommended because there's no financial incentive. And so let's just pick something. Let's just pick kidney disease. How do you know what to take in terms of supplements? It's like a lot of times MDs wait till you're so far into the thing that's going wrong that then there maybe is a pill or a procedure or something. How do you do that? How do you find that person that is open to both? Because it doesn't seem like there is many of those people. And maybe I'm wrong. Maybe I'm cynical. I don't know.
Well, I think there are different strokes for different folks. So certainly, if you're not happy with your doc, and many of us, right, we're human, we are looking for someone that looks like us, walks like us, has the same hair color as us, and feel like there's an automatic chemistry and synergy. And so that's going to be the better choice for you. Women prefer seeing women, men prefer seeing men, et cetera. As far as the supplement thing, it is a complicated space. There are many supplements that you don't actually know what is in the pills. There is actually no way to know. And then it becomes difficult to do studies because there is actually so much snake oil that is in the supplement space. So there are really good reasons for that. When people get sick, one of the first questions is, I took this zinc vitamin C concoction, Dr. G, and that's what I did. And they say, well, we live in Florida, can literally pluck an orange off of any tree for 50 cents or less, and wash your hands and get some rest and take the day off work, right? Nobody wants to hear that. But if you actually do, sometimes keeping it simple is actually what the human body needs, right? And the more processed stuff we put in our bodies, it's a different reaction. And we're learning those things with time. And now there are stages in life, right? Again, menopause, post 70 years old, post 60, there are certainly stages in life where if you're not getting enough vitamin D or calcium, that's when there's a role for supplements. There is no silver bullet for a lot of these things. So it is really best when done with an understanding of your your health status, your kidney and liver function in particular, and then what is the goal you're trying to achieve, right? Do you have osteoporosis? Well, then that's a different conversation. Or are you just trying to be healthy? In which case, I would say eat well and move well, right? It all depends. So that's the thing. I think too often the message gets blurred and general advice is applied to things that are actually not general situations.
I was just talking to my wife about this today, that some people have an idea that they can live more on supplements than they can on food. And when you think about the name, it's a supplement. It's supposed to supplement
Exactly.
the things you're eating, not replace.
The closer we are to what is natural, that is always going to be the best, always going to be better as a general rule, right? Of course, there are exceptions, but generally, if you can have the orange versus the vitamin C tablet, right? If you can have the salad versus the supplement, it's always going to be better. Not just, and again, and there's trade-offs, right? Because there's the vitamin piece, there's the mineral piece, but then there's the processing on the gut and all the other sort of downstream effects that are hard to explain in science, but you might get one benefit and then you might get something else that you hadn't even thought about, which wouldn't have happened with the actual fruit as opposed to the supplement. Does that make sense? Again, that interaction with the kidney or the liver, not going to happen if you have a piece of fruit, but can happen with the supplement and the interaction. So those things are they're very nuanced, hard to explain, but that's the reality. And that's why, science is complicated.
Yeah, I'm sometimes the more I do talk about this stuff, the more confused I get.
And you're in Los Angeles. I'm sure you guys have the same problem. We live in Miami. Everyone seems to have low vitamin D. The reason everyone has low vitamin D is we spend most of our time inside in air-conditioned places on computers. But if you actually want to get more vitamin D, Bob, you could just go for a walk every morning. You could literally go for a walk every morning instead of taking vitamin D supplement. But our lifestyles have become so that it's so impossible to do that, and it's easier to take a tablet. And if that is the option, then rather than having low vitamin D, I would say yes, take the supplement, right? So that's what I mean about understanding. Because if you said, look, I just not realistic for my lifestyle. I'm attached to a desk between 7 to 7. And that would be a great scenario where I'd say, well, then look, that's just not going to happen for you. So let's do this so that you're not breaking your bones, right? But understanding that, as opposed to if you said, oh, I'll just adjust my schedule, and doc, that would be easy. I can do my computer stuff half the day, half the morning from outside. Then that would be my first choice. But I would have to know that about you, and you would have to say, yes, no, this is what, right?
Right. Well, that brings you to the other issue, which is how much time can a doctor spend with a patient, because that requires a long discussion to get to know somebody. In a lot of these sort of places, it's like you got 15 minutes, or the doctor is booked in such a way that they can't do it.
The healthcare system is complex, and there's no doubt that the friction in the healthcare system interferes with the doctor-patient relationship. Docs would love to talk to patients all day.
Yeah, I know they
Here's
would.
the problem. Yeah, here's the problem, right? And I'm sure your daughter's going to go through this in her training, but we're burdened with so much paperwork, so much legal mumbo jumbo, so much liability checks and balances, so much technology that works against us that it's hard to even have 10 minutes in a visit, right? And don't mention the reimbursement of all the time you have to spend after hours that you don't actually get reimbursed, but you're expected, to be on duty. And any other profession, lawyers being one of them, you have one call with them and they're going to just cha-ching, right? Nobody's doing anything. And so the healthcare system certainly has just so much improvement to do. I think the best time to do that now is in a post-pandemic world where we have seen the healthcare system really fall apart. And there could not be a better time to bolster our healthcare infrastructure and system and program. But no doubt it is a tough environment to practice and really have that relationship that we want on both sides, doctors and patients both.
Well, I like when I have, I don't spend a lot of time at the doctor. It's just not something I like. But if I do an annual physical, for example, I do that, and But I like that my doctor is always running late because it means he's spending time with his patients. He's overbooked. And when he comes and sees me, he does it with me. He spends time. And I really appreciate it.
You should tell him that. I would tell you in a time where there's so much burnout, it would be nice. It would be so lovely if a patient said that. So you should definitely,
And a lot
definitely
of
tell
the
him.
things we talk about are not my medical stuff. It's just life stuff. You know, it's just, I think he's just happy to talk to somebody who's not dull.
It has great hair. Has great hair like you,
yeah.
huh?
Okay. Now, like this morning, being a 70-year-old man, I get a lot of, and I'm on TikTok and Instagram. I do about 10 minutes a day of just sort of, I like strange people. I like that kind of stuff, but I get a lot of ads coming at me. And one of the reasons how they figured out that I'm a male at 70 years old, I guess they can do that. So I get a lot of ads for prostate stuff. Who knows? There's different protocols. There's supplements. Oh, it's this versus this. This is how the test came out. I don't know. I have some people that say the natural supplement saw palmetto is great, and other people say, well, it's been proven not to be all that great, and there's something else. How do I figure this stuff out? I don't know.
It is confusing. So the first thing I would say is anytime you are looking or information is coming at you, right? Number one, look at the source. Right? Where is it coming from? Is it from the Cleveland Clinic? Is it from the CDC? Is it from John Doe? Right? Second, you want to be looking for, is the advice that this source giving me, are 20 other places saying that, right? Does the CDC align with the American Pediatrics Association, align with the American Medical Association, whatever it might be? But the idea being that you're looking at multiple credible sources that are actually all in alignment. Third, sometimes you just got that spidey sense. I call it the spidey sense when they're just using like that something provocative, like always and every, like very extreme language, like any 70-year-old, da 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 da. And then selling you something, whether it's subscribe here, like here, or hey, for $10 for the low price, you said it earlier, $1 a day, which is $365 a year.
Yeah.
Small amount, right? Those are just some really quick tips to be mindful of. And the last one, which we probably don't think about too much, and we saw more of this during COVID, if you are not sure and you're still kind of vetting this source or vetting this information, Bob, do not send it to 6 of your 70-year-old male friends.
Oh, I don't do any of that.
Now you have participated in the spread of these falsehoods.
Yeah.
Right. You've now amplified this message that you actually weren't even convinced of yourself. And lastly, if you have a doctor, check with your doc and say, hey, I heard about this thing. I'd like to run it by you. Is this legitimate? Is this not? What do you know about this? Those are really important steps because you know what? If you're following an actual, real, accountable doctor at the Cleveland Clinic, Mayo Clinic, whatever said hospital, they're generally not selling you anything. They're accountable for the information they're giving out there. Hey, here's the 3 tips you need on a colonoscopy. Chances are you go make an appointment with them, they're accountable to that. They're not going to change what they said in the visit from what they're saying on TikTok, right? So these are people that are also very much accountable. Whereas someone who's actually not truly a healthcare professional or not really accountable, it's easy to say anything because they don't actually have a license on the line. They don't actually have a reputation or a business or a professional sort of circle that they're in. So looking for that too. And ideally, if you find a doctor who has a social media presence, even better, follow them. Follow that person, you know them. It becomes someone you can, again, really hold accountable and say, well, doc, I saw your video. And so those are actually the best. And Cleveland Clinic does this really well. I actually have a whole chapter on the Cleveland Clinic in chapter 8. And I talk about the partnership between Cleveland Clinic and YouTube and how it was such a spectacular partnership because that's exactly what the chief marketing officer said. Look, I'm going to get the message out, but my docs need to say it. They need to say it, comb their hair, get on camera, and YouTube, you give me some real estate and I'll make sure everyone knows the top 3 things they need to know about heart disease and diabetes, et cetera.
That is a great place. They have a lot of podcasts that come out of there too.
They do.
And it's, I think it speaks to the fact that it's a private enterprise. It's a private hospital. I'm pretty sure because I was looking into maybe doing a podcast for UCLA and they're not interested because it's corporate. It's run by MBAs now, and they don't want to do anything like that. It's too risky for them. It's not even understandable, the value of it. It's a lot of factors. So they're not interested in something like that. Now there are some individual doctors that kind of have their own thing, but as an institution, and people they don't do it, but people they crave the information. They really want to know it. And the Cleveland Clinic's been very successful at that, as you know.
That's exactly right. I wish in our battle against mis and disinformation, there were so many doctors out there spreading the facts. Like I said, if you understood the difference between a virus and a bacteria, no one could ever convince you otherwise, right? If you knew the facts, just like we know the sky is blue, nobody could tell you it's purple because you'd be so sure, right? And so I think we do need more of that, and we do need to not look down on marketing and not look down on these tactics. I think it's critical for business. I think it's critical for patient acquisition, patient retention, brand loyalty, building trust. I mean, these are all words we use in business, but it's nothing but patient engagement and amplifying the conversation between the doctor and patient outside of the four walls of the hospital. When you are curious, you should be able to find your doctor. You should be able to know what their institution says about XYZ condition. And we've just not prioritized that. And that's one of the things I'd love to see in a post-pandemic world where we say healthcare should own the narrative. If healthcare was so loud, if healthcare leaders were so loud, no one would be sending you all this stuff you're getting every morning about, coconut oil for prostate cancer or whatever they were offering.
I don't know what it is.
If you knew all the top prostate cancer experts and they were so easy to follow and understand, you would not even, right? You wouldn't even be.
Oh, I mean, one of the biggest things is being a bald man is cures for baldness.
Growth for men, right?
I don't care, so I'm not susceptible to it. I honestly just don't care. But the other thing is, if that were true, I wouldn't exist as a bald man. If what you're saying, it's such a secret and only we know it. I mean, that's bizarre. No, if I would know 50 people that are bald guys that aren't bald anymore, if your thing was real, I would know them.
That's right. That's right. And that's another great myth buster, right? That's another great way to know mis and disinformation is saying that to yourself. Well, hey, that just doesn't make sense because I know this is like a universal issue, in the world. But nope, you're right. You're absolutely right. I can't wait for your daughter to come on. I'm gonna have to listen to that episode.
Yeah, I actually never thought of it until you said it, and
she'd be
I don't know if she'll
great.
be too shy to do it. Maybe she won't. I don't know.
Oh, I think she would be so cool from the eyes of a doctor in training.
Yeah.
What she's seeing, thinking, and your viewers, I have to imagine, would love that.
I would think. So what are some of the things people, do you have any specific things that are sort of prevalent that kind of irk you being promoted that you just go, come on?
I think one of the biggest things remains, baldness is a good one. Supplements we've already discussed, but weight loss, especially with
oh my God.
Especially with the GLP-1s. I mean, look, what I would say is we've seen so many weight loss miracle cures come and go. Obesity remains a problem. I think it will remain a problem. What we have to understand about weight loss that lasts, weight loss that is, not temporary and not fleeting, is to do weight loss right. It has to be a comprehensive program like all human behavior programs. And it is for all the reasons we talked about earlier too, because weight is so complicated. There's a mental component, there's a physical component, there's a genetic component, there's an environment component. There's so much to do with these intangibles in lifestyle and culture. And so the idea, I know it's a grand idea to think we can take a pill to solve all our problems, but it actually doesn't work most of the time, whether we're talking about mental health, whether we're talking about weight loss, whether we're talking about baldness. It's never that simple as much as we want it to be. Like we're so bought into that, I think, particularly in a Western society where there's a pill for it, I'm ready to take it. But if I have to go for a walk to get my vitamin D, I'm not interested. Right. So there is this piece. And I feel that weight loss is perhaps the biggest myth out there. And that's what it takes. It takes more than any pill or any injection. It always will.
Well, that's a lifestyle change.
There are some things that are genetic, and
Yeah.
there are endocrine issues.
Yeah.
And so in that case, you lean on the medicine, you lean more on the medicine, but you still have to change the other things, right? This idea that you can only do one part, it never lasts. That never lasts, right? And there are side effects, right? And there are all these things that you have to take into consideration, like any therapeutic. And so you have to do the pro con list, just like the fountain of youth, right? Want to look younger, want to look less bald. I mean, it all kind of goes back to vanity, I guess.
Well, it's yeah, and it's the terror of dying, I think, is way underneath that. It's just like, I'm really scared to die. I don't want to die. It's a bad thing, which is who said that? I mean, it's the end of one thing for sure, but is it a bad thing? I mean, everyone is going to have that as an issue. So why are we looking at it that way? But if it's a fear-based, it's a lot of fear-based decision making that people are doing, and the desperation out of that fear, makes you not rational, and be in denial and have a lot of wishful thinking that just isn't going to happen. I feel that sometimes there's a lack of acceptance of what is.
Now we're again getting very philosophical, but this idea that you're 50 years old, but should want to look like you're 20 years old. Right. I mean,
Yeah.
I think that's fundamentally the flaw. It's, of course you want to be the best 50-year-old you can be, both inside, outside, right? The way you feel, the way you move, walk, think, talk, etc. But I think that that's often what I find is you're chasing the wrong goal. And so I also spend a lot of time with patients on what is their goal. And I try to level set on those expectations. So if you already have joint disease, you already have disabilities, I'm very clear on those things can't be reversed, right? Or if they can, likely require a surgical intervention that is still not going to get you back to where you were when you were 20 years old, right? And so I think we have a hard time adjusting expectations and goals, but that is part of understanding your body. That is part of understanding your body. You're never going to be 20 when you're 50. Now you can be the most optimized 50-year-old, and you should absolutely aim to be that, whatever
Yeah.
stage of life you're at. But I think that's often sometimes expectations are important. I think expectations and understanding what's, realistic,
Yeah.
even with the best
And then I go
medicines.
back and think about, well, how happy was I really at 20? I'm not particularly. I mean, kind of confused. And
Youth, one of my favorite statements is youth is wasted on the young.
well, it
And I
is.
think it's like universal, right? It doesn't matter where any of us were. It was a total waste, and we didn't realize what we had, right?
Well, and then people, I wish I knew then what I know now, except the thing is, if I knew then what I know now, I would have no friends back then because I wouldn't be able to hang out with them because they'd be
Oh,
complete immature goofballs, and I wouldn't even want to hang out with them. They would just not be of interest to me. So
well,
nobody thinks about that part except for me. That's why I
yeah.
have a podcast.
I feel like you would grow out your hair, Bob. I feel like you would have
You-
like grown out your
yeah.
hair, right? Wouldn't you? I feel like I would have worn more sunscreen. Like it's these simple things that you're like, that would have been a really smart thing to do.
Yeah, maybe.
Best wrinkle
Now,
prevention
now,
is actually
now, my mother used to say that the reason my hair fell out was that I smoked too much weed. And that's her reasoning. So
your
that's,
mom.
but
Your mom should put that all over Instagram.
that was her feeling. And I was like, I don't think that's it because there's plenty of people that smoke a lot more weed than I do. Got plenty of hair. Why
I think
don't
your
we
mom
take a
wanted
look
you.
at some of the male
She
pattern
wanted you.
baldness in our family? How about that?
Your mom wanted you to stop
Well,
smoking
yeah, of
weed a long time
course,
ago. That's what I think. That's what I
of
think.
course, of course, she did. It freaked her out. She was scared. She came from a different generation. I mean, to her, there was no difference between that and being a drug addict in an alley somewhere.
You turned out all right. You did
I
okay.
guess so. I mean, here, let me say this: when I was in my 20s, I was eating a lot of. I was drinking a lot and smoking weed and no exercise, zero exercise, and eating fast food. Okay. So, I mean, I don't do any of those things now. I had cellulite in my 20s on around part of my stomach. Unbelievable when you think about a 20-year-old. I was probably 24, 25, maybe 26. Had cellulite. It's unbelievable. Those fatty deposits in my, just from that poisonous junk food I was eating. I don't have any of that now. I mean, that's fixable stuff with nutrition. So how do people, let's talk about your book for 1 second before you go. How do people get the book, say the title, and how can they contact you?
So the book is at every bookstore as well as on Amazon, which is I know where most folks are getting their book. The book is called Dead Wrong: Diagnosing and Treating Healthcare's Mis and Disinformation Illness. And I am easily findable both on my website, drgeetanayyar.com, or Facebook, Instagram, Twitter, LinkedIn. Come over, have coffee. We'll read a book together.
Look at you, all over the social networks. I love it.
When you got to sell a book, that you got to do that. That's what they told me.
That's the new thing. I guess you have to do it. Well, congratulations on the book, and best of luck to you. And thanks for all the great information and the great talk. Best of luck.
Thank you so much, and please wish the best to your daughter. And if I can ever help her in any way, let me know.
Well, thank you. How generous. I love that. Thank you so much. Have a fantastic evening.
You too. Take care, Bob. Thanks.
Much appreciation for you folks listening to The Exploding Human. If you're interested in the website, it's theexplodinghuman.com. You can also listen on YouTube. That is The Exploding Human with Bob Nickman. Once again, I want to thank Geeta Nayyar for being on the show. And please check out her book, Dead Wrong: Diagnosing and Treating Healthcare's Misinformation Illness. You guys have a fantastic day. Thank you.